Hey everyone, welcome to the Front Row with Ed. Today we're going to talk about humeral fracture and swelling of the hand. So quick story, I have an actual patient that tripped over her foam roller, unfortunately. I still love the foam roller, but she did trip over her foam roller and suffered a pretty severe humeral neck fracture. So right through here, and she literally slid it over here and had a pretty significant fracture. The positive thing is she didn't have to have any surgery or anything like that. So she was in a sling for 6 weeks, but what happened is while this shoulder was healing, she developed a significant amount of swelling in the hand, which is not uncommon for people that have shoulder surgery to then develop swelling in the hand. But to understand why that happens is to understand the lymphatic system a little bit better. So let's take a moment and talk about the lymphatic system and how it's designed.
The human circulatory system processes about 20 liters of blood per day through what's known as capillary filtration. Approximately 17 liters are reabsorbed and 3 liters remain in the interstitial fluid. It's the responsibility of the lymphatic system to then provide an alternate route to the return of the blood. So what drives this lymphatic system? 2 things drive it. Number 1 is muscular contractions, and number 2 are one-way valves that prevent backflow. So you can see on the right, there's an enlargement of the one-way lymphatic vessels. But what happens when someone is in a brace or in a sling and is unable to use a muscular contraction? This is one of the main reasons why we have lymphatic stasis in the hand and the arm after shoulder surgery. In this slide, you can tell how 2/3 of the body drain underneath the left clavicle. So both legs, left abdomen, left arm, and the left side of the head and neck will drain underneath that left clavicle. And you'll see those enlarged squares on either side where thoracic duct drains into the subclavian vein. On the right side, you have the right upper extremity, the right side of the chest and abdomen, and the right side of the head and neck will all drain right at the inside of that clavicle or that collarbone. If you are a body worker watching this, make sure from a clinical standpoint that you work on that SC joint to reduce any myofascial tension or trigger points, because ultimately that is the terminal deposit of lymphatic fluid. I put this slide in here for you to appreciate the regional groupings of lymph nodes. And since this video is particularly about hand swelling after shoulder surgery, I want you to appreciate the axillary lymphatic nodes. So we have a huge number of lymph nodes basically in the armpit area that are responsible for helping to collect the lymphatic fluid that is brought up from the hand and arm, dumps into the axillary lymph nodes before it moves on and dumps back into the venous system. Therefore, when we do some exercises, we will be doing some pumping, if you will, in that axillary region to help stimulate lymphatic flow in that arm, in lieu of the fact that we can't use that arm because we just had surgery. Also notice too, in the lower extremity, in the inguinal area, is where we have the largest grouping of lymph nodes for lower extremity. Any type of knee or ankle swelling after surgery would require some work in that inguinal region to help provide lymphatic flow.
So as you can see, this right arm is going to drain underneath this right clavicle, and both legs and my left arm, left side of my head and neck is going to drain underneath here. So if you're a practitioner watching this, when someone's in a sling, she's got pretty limited range of motion, but you really want to try to work on opening up what's known as the thoracic inlet. So that can really help with lymphatic flow. What can the patient do? So this is going to be a little sequence that I'd like to give my patients who have any type of hand or upper extremity swelling after shoulder surgery. So the first thing they'll do is they'll take their opposite hand. In this example, I'm going to use my right arm as the operative hand. So what they'll do is they'll take the left hand and they're going to come up into the pecs, right up and through here. Like we saw earlier, there are regional groupings of lymph nodes in this axillary area. So you're going to grab this pec, and I'm going to pull up in this way. And it's going to be nice and easy. It's going to be 10 times, all the way up. It's almost like I'm priming the pump a little bit. It's going to be a little uncomfortable, and that's okay. You're just going to dig into that belly of that pec, and you're going to pull up. Remember, lymphatics work on one-way valves and muscular contractions. And since I'm in a sling, I'm not going to be able to have many muscular contractions, so it's another reason why I get this lymphatic stasis. So I do my 10 pec pulls to basically prime the pump. You know, like you take that weed eater and you kind of prime that pump a little bit with gas, same kind of concept. So we got 10 times, nice and easy. Then we have superficial lymphatic channels that live right underneath the surface of the skin. So we're going to start at the distal end or the lower part of our arm, and we want to make sure that we cover both the front and the back of the arm. So however you want to do that, but I'm going to take my other hand here and I'm going to come all the way up beyond the clavicle. And I'm going to do that 10 times. Now I've got big hands, so I can cover most of my arm, but however you want to do that. But I want 10 strokes, and they're light superficial stroking. Starting from here, working all the way up past the clavicle. What are we doing with this? We're stimulating the superficial lymphatic vessels to help drain into that local regional collection site, which will then eventually drain right underneath this clavicle. So as long as it's not contraindicated by your doctor, working on some shoulder shrugs while you're healing from surgery, if it's okay, is a good idea. Also getting a little squeeze ball, squeezing that as many times as you can is also a good idea, because the muscular contraction helps move that lymphatic fluid since it's a one-way valve. And repeat that little sequence 3 times a day. In the interim, work on squeezing the ball, shrugging the shoulder. If you go and you see a physical therapist or body worker of some sort, make sure that they work on clearing up this thoracic inlet a little bit through here where the jugular veins are, where those where the lymphatics dump right back into those thoracic ducts. So we'll see how you do with that. There's also a similar version for your legs, so if you have any type of knee surgery and if you get any swelling in the foot, if there's a need for it, let me know in the comment section down below and I make a short video on that. But this one will hopefully help if you have any type of hand swelling after shoulder surgery. Please pass the word around. If you have any questions, leave a comment. And thank you and good luck. Have a great weekend. It's Friday. Bye.